Around 13% of Lubbock's population has tested positive for COVID-19, but antibody testing is showing more have been affected. KLBK's Olivia Whitehead joining us now. Olivia, what does this mean for those that are unaware of their exposure?
Well, Terry, believe it or not, many people testing positive for COVID antibodies had no idea they had the virus in the first place. What experts are realizing is many people have carried the virus without ever experiencing those common symptoms, which in the end is adding to the spread.
If you think about the number of cases we have in Lubbock, there could be double or even triple overall in our community that we don't know about, because asymptomatic people, 30 or 40%, have no reason to get tested.
A voluntary study done throughout the country and right here at Covenant.
You know, we've had tens of thousands of people participate in this study. It's the largest antibody study to date.
The goal was to target healthcare workers and compare their exposure to the spread in the community.
At most, the caregivers that work for us in different parts of the country look like they may be at or below the community background, which is extremely reassuring to us because it's possible that working in a hospital may be protective.
With some coming to find that they were unaware they had been exposed from the beginning.
I had body aches, fatigue, and like gastro issues, but I didn't have like fever or coughing or trouble breathing, knowing that this is a respiratory disease. So I wasn't for sure if it was something that I had. So went into the clinic, got the lab draw. About 2 days later, got those results back, and sure enough, I was positive.
And some doctors say there's one factor leading to that spread.
I think we're going to find some percentage of people who have been tested, like Troy, and had no idea that they had been infected. Unless you're tested because you had a known exposure, we're probably not going to test you. And the protocols now say, even with an exposure, if you're asymptomatic, it's not recommended to test unless you become symptomatic.
Now, another factor that experts stress is antibodies do not give you a free pass. They're waiting on further results to test how long immunity lasts, but they have seen cases where those testing positive have been reinfected. For now, they stress the importance of listening to your body and doing your part to slow the spread. Terry?
All right.